Hello, everyone. We welcome you to another Sunday of conversating. Today, we will be talking about health. This is the second part of our health series. We are joined by some lovely people who you will get to meet in just a minute. Before we actually get into the conversation, we're going to go ahead and introduce the panelists. And we will start with first, who is on with us right now hosting, which is myself, the Director of Programs here at both sides of the conversation. And we also have...
I'm Rico Hamilton, co-founder of both sides of the conversation.
And I'm John Henry, co-founder of both sides of the conversation.
All right, and before Rico introduces you to our panelists today, we want to go ahead and review our community standards. And John is going to remind us again what we value here when we enter these conversations of various topics every Sunday. And we also want to ask that you take the time to go ahead and share this video on Facebook. Go ahead, start a watch party, tag people in this video if you're watching on our Facebook group page. Let as many people get included in this conversation as we can. And John, do you want to go ahead and just review our community standards?
Yes, our community standards for our new guests and new members, both sides of the conversation. We are providing a safe and honest space for open conversation. Please be respectful to that. Please be respectful to all the panelists, hosts, and participants. Today's conversation is a great conversation. We do have a little bit of debate sometimes about the conversation, but it's encouraged. We do not allow anyone to do any kind of personalizing, no name calling, bullying, trolling, shaming. None of that is allowed. Your perspective is yours. It is not a prescription, but all perspectives should be respected. You don't have to agree, but definitely want to have a respectful conversation.
All right, and Rico, do you want to go ahead and introduce the panelists that we have today? I will preface this by saying we have some very educated people to lead us in this conversation. So Rico, do you want to go ahead and give them an introduction?
I definitely do. So I'm gonna do a brief one. I'm just gonna say names, and then hopefully, as I say your name, if you can just, kind of tell the folks what you do. I think that they both in conversation do some amazing stuff in our communities. They know a lot of things. That's why we brought them on to have this conversation. So first I'll start off with Nicole Howard. She's doing some amazing stuff. Very smart young lady. And she has all the numbers. So I'm gonna I want all the numbers. So can you tell folks what you do, Nicole, please?
Let me make sure I unmute myself. Good evening, good afternoon. So I am a registered nurse. I've been a nurse for about 10 years. I actually started out working on the telemetry unit, which is for those that don't know, it specializes in cardiac and heart functionality. I then transferred to clinical informatics, which basically is more of a technical side of healthcare, where you're dealing with data analytics and you're dealing with the EMR functionality in hospitals across the country. I recently actually just got a nice cool position working for the Department of Public Health in San Francisco. So it's really exciting to be able to support during this crisis, is really what we're in, this global pandemic, and sit alongside of some great, amazing, smart folks that are going to champion us through this difficult time. And San Francisco County is kind of like a melting pot kind of county. So it's kind of cool because they have a lot of disparity, a lot of mixed cultures and mixed behaviors in a sense of healthcare. And so it's nice to be a part of crunching those numbers and figuring out what the community needs to be safe and be aware. Thank you guys for having me.
We also got James Harrison, brother doing some amazing stuff, licensed clinician. Hey, yo, he's a brother. So, they always talk about we don't see brothers and sisters who doing the work and helping Black people heal. I see one right here. So how we gonna be able to get him to the city? I don't know, but I'm gonna figure something out. So James, can you tell folks what you do out where you're at?
Absolutely. So I'm here in Oakland, California. My background is in social work, So I actually started working with the deaf and hard of hearing community first out in DC, and then transitioned out here to Oakland and actually to San Francisco first. And I was working with youth in the foster care system, providing family therapy, individual therapy, working with some groups, and then started working with folks in medication management after I started working with kids in the foster care system. So people who were experiencing mild to, I guess, severe symptoms for mental health, being able to support them and getting connected with psychiatrists and with different therapeutic services. And right now I have my own private practice here in Oakland and seeing folks on the spectrum, basically supporting folks with communication needs, talking about anxiety, depression, trauma, just supporting folks and being able to live their best life. So I talk about being compassionate, being courageous, and living empowered with folks, and just seeing how they can just improve their lives and improve the conversations they have with their families and people that they love.
So you only do your private practice in Oakland? Do you get like referrals from San Francisco and stuff like that also?
So as a licensed clinician, I can see folks in the state of California, and I'm also licensed in Arizona. So anybody who wants to do private pay, I'm not accepting any insurance right now, but that might change in the near future. But for the most part, anybody who's in the state of California or in the state of Arizona can reach out for services.
Okay. Well, we're gonna have to connect on after this, because we got a bunch of young brothers that we work with, me and John, that need some support. So we'll be definitely reaching out. So John, so if you can just kind of like start the conversation. This is just one of them conversations that we wanted to have with our community. Like the many other conversations we had last week. We talked to former Black Panthers, and they were talking about their free healthcare programs. And it was an amazing segment. But we wanted to dig a little bit deeper as we talk about health and the health issues that are happening in our communities, and why we at higher rates of heart disease, why we at higher rates of mortality in our communities. So we're going to dig a little bit deeper. So John, can you add a little bit more context to the conversation so we can just dive in?
Yeah, so I think part of the conversation is that we understand that in the Black and brown community, we get hit the most with all the disparities in healthcare. A lot of it has to do with stigma. People don't want to go get seen. But with this COVID-19, it kind of taught us a little bit more how the underlying health issues of everything else is really affecting us. And by Nicole being a data person with numbers, we'll probably get a little bit more clear understanding. And I guess my question was how, because here at both sides of the conversation, we want to talk about the issue, but we also want to come up with solutions, right? And then the brother James, we got the mental health part, the trauma that's affecting our young people from, domestic violence or just growing up in the community with violence, the traumas of just dealing with, growing up Black in America. So how do we come up with the solution to fix some of this stuff? And we know healthcare is part of it, having to go get the treatment, go get the help. But because of the stigma, how do we get our people energized to get out of there? And then we have the other part where we're dealing with the medical stuff, with all of the malpractice stuff or the issues that's going on in the medical. How do we affect change from you guys' perspective? So I would just start off saying the diabetes, the obesity rate, the cancer in our community. From a professional side, what do you guys see our number wise? Why is it that we have the highest numbers with those issues? Is it environment, or is it just nutrition, or the way we was raised and taught?
I can jump in.
Oh, go ahead.
So I of course, I have a couple of reasons why, and this is all not inclusive. Of course, it's not everybody, but it's obviously the number is so high that you guys, we are in textbooks. I remember when I was in nursing school and a classmate of mine being, I think, one of the only African-American males in the class, he got tired of hearing when we were studying COPD, asthma, diabetes, African-American male, number one, African-American male, number one. It was like, he was like, dang, can I get a break in here, because we're in textbooks. And so we all know that this is all data driven. These things don't get in textbooks on internet because people just pull them out of the air. A couple things I wanted to talk about was just, again, the traditions, the family historical way that we prepared our meals for our family, based on financially or based on just what we know, what's available. One of my public health assignments was to go into the community to see how close was a grocery store to your local, you know, less fortunate neighborhood. How close could they get to a really great grocery store that had fresh vegetables, produce, meats, and it's sad because a lot of those things are difficult to get to. So that's one of the reasons. A lot of the things too is that, I'm sorry to say, but, and I don't really know why, but we don't trust healthcare providers, even in 2020. I get years ago, we don't trust them. We just don't believe what they say. And we're non-compliant, you guys. And I got family that's non-compliant. I got a good girlfriend of mine, and she's hypertension, and she kind of takes her meds, kind of don't. I mean, you know, I don't know why that mindset is there. And then of course we have the fact of just pure, really not believing and just not really taking it at face value. And this might bump a lot of heads too, but I believe there's also a religious component. A lot of our seasoned religions folks believe that healing comes from a higher power, thus they don't need to do interventions that are required. And so I believe there's a couple things. I'm sure James can chime in, but this is what I see and what I've read, and what I've experienced. And so I think the numbers are high based on various reasons, and some we cannot control because, you know, some of the environments that we're in, but some we can make some lifestyle changes, which I would love to see more of. I think we're getting better. I know I could speak for myself. I remember growing up on whole milk, vitamin D milk. That's all. I'm the oldest of 5. It was 7 of us. We had the big, you know, the moms, the dads, we would just buy the big thing of vitamin D milk, white bread, slap everybody peanut butter and jelly. I mean, that's what we did. Ground beef, like the big ones. I mean, this is what we did. You have a feed a family of 5. But I remember raising my son. I didn't do that. And to be honest with you, I don't necessarily know what changed that because I wasn't rich. I've been on welfare, you know, not no money either. I think it's just maybe having more knowledge of what the consequences are. Maybe.
Yeah. James, you want to jump in there?
Yeah, absolutely. I was going to jump in. I agree with everything that Nicole has shared so far. I'm sure I will continue to agree with her as she speaks. One of the things that comes to mind, and when Nicole is sharing, is just the education that we receive about what's healthy and how we pursue that. Right. I think that there's a lot of different ways for me to approach this. My mind kind of has these like firework moments, and I tell this to my clients this all the time, is that there's a lot of relationships that we have naturally, right? That we have with folks in the relationships with folks that we trust and folks that we don't trust. Like if folks who are going to, you know, I say just thinking about Black folks in general, right? When we go to the barbershop, we go to the hair salon, we have relationships with those people, we have conversations with them. And based on those conversations, we start to create certain patterns or to believe certain ways of being. But do we have those same kinds of relationships with doctors? We have those same kind of relationships with nurses? Are we having conversations with them to be able to better understand what's accessible to us, right? And what I mean by that is when we talk to somebody who's in a mental health profession, are we talking to them in a position where it's too late? Not to say it's too late, but we are now in a crisis situation. Like we have to be in a hospital and they're giving us, you know, medication, or they're giving us, you know, these treatments, and we're like, well, I wasn't used to doing this before. Now I'm being told that I have to do it, and I don't want to do it. I'm resistant to it, right? But if it was something that I had been practicing potentially, I don't say all along, but I had some awareness of, I was already having conversations with people about it, then the likelihood of me being able to change or to be able to do something differently is there, right? Does that make sense?
Make totally sense. Make totally sense.
I mean, I'm happy to answer questions about those kinds of things, but I think that, I mean, in line with what Nicole was saying is that when I'm thinking about food patterns right now specifically, right? When I guess before we got started today, we were talking about, you know, what Big Mama used to cook and all that, like what it's like for us to think about what it means to eat healthy, where healthy food is accessible to us. I think over the last few years, especially, I've been looking a little bit more into biological health. What I mean by that is just kind of nutrition in general, right? And who's putting information out there that's allowing for us to see food different, right? And instead of looking for things that have a barcode on them, what does it look like for us to go out and look at farmers markets or look at like whole food products that can be enjoyable? And I think it was last year or maybe 2 years ago, I was over at the museum in San Francisco, and this guy Brian Terry, I'm not sure if y'all familiar with him, but he does he has like his Afro vegan book, but he also is I don't think he's vegan himself, but I think I got introduced to him because there was this place in Oakland called Brown Sugar Kitchen. It's a Black-owned restaurant here, and
Okay.
I saw his book there, and I was interested because I do a plant-based diet, but he was introducing different ways to enjoy these plant-based foods that are enjoyable. It can be enjoyable for us through smoothies, through different things. But he also had this guy, and I apologize for not remembering his name right now, but he was taking the vegetables and he was creating beats literally out of the vegetables. Like he had his whole sound system set up as like a DJ table and everything, and he was using it as like a drum machine essentially. So it's allowing for kids to have a different relationship with these fruits or these vegetables, so they can kind of play with them, but also be curious about what they taste like, right? So I think that making the information engaging, making it something that we can kind of play with, so to speak. People say don't play with your food, but he's playing with the food so that the kids can have something to relate to. Being able to have conversations about what it's looking like to enjoy those things can be helpful and change in how we think about what's healthy for us.
Yeah, that's good information. Hey, Jada, can you take a look? And I don't know if the panelists can see the question and answers. We got question and answers coming in. Also, if there's any medical professionals out there that want to jump into the conversation, or if anybody that's in the chats want to join, please raise your hand. We'll pull you up. So we'll start bringing those questions in a second. But one of the things that's interesting that you guys both said that I think definitely in our educational system, there's a big failure on educating people and our youth on the nutrition part. Because I've seen some of the curriculum around nutrition is kind of like the 7-part meal thing, but they really don't go in depth and fully educate the families and the young people of like the proper food and nutrition that they need. And I think that's where some of the gap comes from. And then, you know, if you come from an underserved community, like she was talking about the grocery stores, you know, in San Francisco, you know, the nearest Whole Food is not in the community where people that's, you know, struggling or financially can't, you know, it's no healthy spots in our inner community, the real low income areas. So, but then the question is, this is where the responsibility I feel comes in with the FDA and the people that's producing the groceries to the communities is, why is it that in our higher end communities, they get the better processed quality food than we do in the lower income areas? And that's like a question I always have, because it's like you could go to Whole Foods, it's like you got this real organic chicken that's probably $10-15 for the small piece, right? But then you come to the community in the neighborhood, and you know, you go to a Super Safe Market or a food co, and you get $15 this big old unhealthy, unorganic chicken. So it's always a trip for me. But I get it. If you socially impacted or financially impacted, it's going to definitely affect your eating habits. Because I mean, you go to Whole Foods, you can spend $100 and have nothing. So how do our people that's on welfare or people that's, you know, poor working, how do they keep up to eat healthy if we know that the healthy meals is what we need to stay out of these health crises?
I think that your points are valid, and believe it or not, they've been discussed based on counties too. If you actually go online, they have all these information about the disparity. They actually have like how far away like in North Richmond, that was one of the, because I live in Cocoa County, Contra Costa County, and I decided to do a project on my own community regarding the resources of just nutrition and health in general. And one of the things I did was go and interview people, because I used to stay in North Richmond a long time, but I mean, I seen the nearest grocery store that's in walking distance. Honestly, I wouldn't go in there today, you know, but some of these families over there, that's all they have, literally. I mean, let's get out of the Whole Foods and Trader Joe's, because they haven't been around that long. Let's just go to your Albertsons, Safeway, Rayleigh's. one of those stores isn't even in a 15-mile radius of this place. So you're talking about a single mom, unfortunately, that has 4 children, getting to the grocery store, getting them back to the house, even with the money, even with the finances, but just maybe lack of transportation, lack of support. It's just, and to answer your question, I don't really know the answers to how we solve that as a community, because we all know our counterparts, and I don't want to call them that, but they're not looking to build those things for us. We're going to have to do them ourselves. And the question I have is, those that are in that kind of environment, and those people that are in those kind of those rooms, those meetings, those rooms, because there are a few of us peeking in there, we should be really focused on those conversations, because they're not going to raise their hand and say, yeah, you know, maybe we should build a Trader Joe's over there on East 14th and, you know, Seminary, you know, let's go get one right on the corner, you know, let's go get one right in North Richmond, you know, because it costs, and those are the people that need to have a seat at the table. But I just feel like you know, our culture has to be the one to make those things a priority. But first we have to make our health a priority, because we don't even see the advantage of the why behind the grocery store, the food. I mean, even the people, I live in Hercules right now, and in Pinole, Hercules area, there's a Trader Joe's and Whole Foods and a Sprouts. And I'm wondering, I don't know the numbers now, but I'm wondering how many brownies are going there and taking advantage of getting those choices of food. Because I will tell you this, it's not just the poor Black folks that's unhealthy. It's not.
Right.
That's a population, and we could argue that that's why. But what about the ones that will spend the money on the cars, the clothes, the watches, the shoes, but when it comes to preparing a meal for their families, they don't take the time out to make decisions on the health and what goes in their bodies.
Right. So, and I think that's a powerful statement that you made. You know, because I did a little bit of just research, understanding why, and I felt like it's almost like a propaganda attack on the Black community, because I started watching the franchises more and more over the years in our poor areas. It was like liquor stores. You know, it's like in the ghettos, you could find a McDonald's, a Burger King, a Jack in the Box, like in blocks, like liquor stores. But everything that was healthy was so far away. So it was like, for me, it was like, are they purposely, you know, presenting this to the community for these health disparities? Is it just a different agenda? But for me, that's what I see in every low income area I go. You can find a McDonald's, a Jack in the Box, every fast food, every unhealthy thing, and then it's like it's price targeting, right? You could eat a better meal. I mean, you could get more use out of your money. I shouldn't say a better meal. You could get better use of your money eating out at McDonald's and Jack in the Box and Kentucky Fried Chicken and Church's Chicken for a family in a week than it is going to the grocery store. And that's what was mind-boggling to me, because it's like a family of 2 can eat out every day at McDonald's and these fast food restaurants and eat more than they could if they went to Safeway or one of the regular stores. So it's something weird, but I just noticed that. Did you want to say something, Rico?
Yeah. So I mean, so I'm hearing a lot, and I'm processing it all. And in processing it, I'm thinking that I know that part of it is intentional, because when you look at, you know, franchises, everything is about dollars. Everything is about money. We know that the Black dollar is the biggest dollar in the world, and we all know that. So when we look at communities of color, why not put your business in those communities and making sure that you can profit, right? Intentionally, in terms of diabetes and all this stuff, I'm not 100% sure about that, but I know the intention is money, right? So I'm looking at James' shirt, right? And I see on the shirt it says it takes a village, right? And I think that when you look at other communities, because right now, like I grew up in the hood, but now I live in a suburban community. And in this community, it's more village type. It's more village ran. Like when things trying to come up in the community, I get a notice, right? And my voice is important in my community. where we all talk about, do we want this store in our community? Is it helpful for our youth, or is it a hazard to the community? And I think that is opposite when we talk about the Black community, as it relates to the McDonald's and it relates to everything else. Like, there's no village talking about, should McDonald's be here, right? Should Popeyes be here? Like, it's an alternative because people, like, some mothers work all the time. So it's like, okay, well, it might be good for McDonald's to be there because I can go and get the quick meal for the babies at some point or whatever. And then later on, years down the road, because I know McDonald's in the Fillmore where I grew up, it's been there since I was real young. And I've never heard no one complain until more recently. And they've been there for almost 30 something years. You know what I mean? So it's like how do we get my thinking is, how do we get the village concept in our Black communities and take away the neighborhood? I hate the word neighborhood. I hate it for some reason. It makes me think of the person next to me got a hood or a covering, and why they covering themselves. For some reason, I think like that. So how do we get the village and the community concept back? Because that's the counter intelligence to some of this stuff that is going on in our community, because the voices in our community are so strong, but they don't recognize the strength that they have in some of this stuff, right? Because I know in Fillmore, the Safeway was created as a community market. I don't know if anyone been to that Safeway on Fillmore. That was created as a community market during redevelopment. In their contract, it says Safeway was only supposed to be there to support the community in turning the supermarket into a Black supermarket. But Safeway stayed. They never left. The information and the education left, right? So, like, a lot of that stuff, and a lot of people ain't privy to this stuff. So I think that's what shatters things is people not being educated on stuff. And then you have like a few folks who is educated on it, and we try to educate folks, but it's not translating as fast enough so that folks can understand like what we're talking about. Because like we'll do this segment, we'll get some folks on it, but then the broader community who don't have access to computers and stuff like that, they won't hear it, right? So how do we get those folks involved in the conversation, for one, but then also around health in their community?
One of the first thing that comes to mind, Rico, is just starting small, right? I know you don't like the word neighborhood. I think just doing block to block, just talking to one person, right? I think that there's been a slow, steady growth of community, what do you call them? Just gardens, community gardens and whatnot, where people are setting up plots of land to be able to feed that specific community, right? I think those kinds of efforts allow for people to see what it's like to have that level of engagement. I keep on talking about relationship, but having a relationship with somebody, say, hey, like I know somebody that's growing these vegetables. Let's at least start to incorporate these into our diets. Like come in and buy this food. That's like when people are going to farmers markets, being able to have a relationship with those folks lets them know that like their product is valuable for those folks there. It's being able to say what John was talking about earlier is I guess everybody's talking about it too, is following the money. You got to know where, and I think John, like Rico was saying, like you got to follow where the money goes. And they've been studying us, and I say they, like the government, like these different corporations, like they've been studying what our trends are for buying for decades, right? When they see that we're going to buy these cheap things, they're going to nickel and dime us until we don't have no more, right? They see what it is that we're going to be so-called, it's not even an investment what we're spending our money on, because we're not getting any return on our investment when we're buying stuff from McDonald's. McDonald's is not doing anything for the community when we're buying something from them. We got to hold folks, and that's the other part, is hold these persons or hold these corporations or hold these individuals, communities accountable for what they're putting into the community, right? In the same way that Rico was saying that we got to, Safeway had their position, they had their contract with the community, they didn't do anything with it. Well, who's going to stand up to them? Who's going to say something about what's going on for them? I didn't share this with you all in the beginning, but I think I'm going to have a little lead in. Like when I grew up on the south side of Chicago, and I remember growing up in the city, and there being these block clubs. And the block clubs would focus on, and I wasn't part of it because I was a little kid, but I would hear about the things that would happen because the kids would benefit from the celebration that we have, the block club parties and those kinds of things, but the parents were also involved politically. They would say, we need to go and talk to the alderman and talk to this policy person, talk to the mayor about X, Y, and Z issues, and they would get that stuff on the ballot, right, for that community. But like for us to, as a community or as individuals to go and have those conversations with people who want to be involved. And I think that a lot of Black folks and brown folks are so stretched thin for just kind of living day to day, but like in this survival mindset, talking about the mental health component, but we're so focused on other things that we want to do what's easy for us in lots of ways, right? So we cope by saying, oh, it's too challenging for me to go and spend carve some extra time out for me to go and talk to this person and do this other thing. But if I'm going back to what I said towards the beginning of this, starting small. How much time can I give, or how much time can I dedicate towards the thing that I want to be able to make a difference in? If I'm talking about my health, I'm talking about making a difference in my community, or doing something with a community garden. Do I want to do this once a month? Do I want to do this once a week? What does it look like for me to kind of start that process so I become a little bit more familiar with this new habit that I want to be able to create? And I think that being able to have that momentum, have that thought, and I can talk a little bit more about the change patterns that we can implement a little bit later, but just starting small, just doing a little bit of something, having one conversation with somebody, going to one event, even participate in this conversation right now helps to start the mental juices flowing about what's possible, right? And then sharing that with one other person.
Right. I want to definitely pose a question to both you guys to think about. I know there's a shortage. I've been reaching out, talking to people. I work for UCSF Medical, and I know there's a shortage of Black nurses and doctors. But then as other regions are part of the United States that we are heavily populated with, Black doctors in Atlanta, in Carolina, a lot of more Black professionals. How do we get more Black youth involved in the medical fields, right? And then how do we have the medical professionals that's already in the field? How do we start linking up and opening up our own community health centers or hospitals or whatever? Because I feel like we need it. It's like, it's enough doctors. I see all these doctors out here. I see all these nurses, and I'm like, how do we make a unified medical front, right? If we know all these issues are happening, how do we as Black professionals, or how do we unite so that we can address our issues, right? Because the biggest thing with this Black Lives Matter movement, everything that's going on, everybody's talking about, what do we do as Black and brown community? What do we do to address our needs? We have to take care of us first. So from a medical standpoint, how do we get to that point where we start getting doctors to merge together to give the help? Because I think some of the stigma will be taken away if we have Black doctors, Black nurses that we could go see in our community. I think more of our older generation will feel more comfortable. But when you come to places, and we in California, so it's a little bit more diverse, but when you don't see people that look like you in those fields, or very minimum, some of those stigmas is the roadblock from keeping us from going to get the help, especially, just switching the conversation to man health, right? We have a big disparity in just men going to the doctors, going to get seen, going to get help. And part of it is, I believe it's the stigma. Part of it, I think, is comfortability. And then how do we educate from a medical perspective, you guys' perspective, how do we educate the community, the Black community, to be open and transparent when they do go see medical professional help? Right? Because I hear a lot of doctors talk about, people from the Black community, they come in and we're trying to diagnose them, or we trying to help them, and then they're not truthful, like, on their lifestyle.
They're not.
Right.
They actually, it's really heartbreaking. To go back to your first question about, just African-American healthcare providers, and that, I applaud James for just the mental health, because more than ever, now we need that, and we won't get any breakthrough without seeing people that look like you and I. But I think that, like, California kind of sucks in a way, because we don't see brownies that look like me and you in a lot of professional positions, and healthcare is one of them. I mean, when I went to, because I've done some assignments across the country, but when I went to Texas, Atlanta, I was like mouth open. Like, they have clinics. They do have a lot of resources in these areas. The question is, how can we get them in our neighboring communities? And let's go back to education. Still some of our people are either frowned upon for taking the route, because unfortunately you kind of got to go to college to kind of get this stuff, and it's kind of going to take a while. It may take some money, and it may take some dog, you know, because I went to Contra Costa. I went to Contra Costa in San Pablo in Richmond. Single mom, I was on welfare. Did I want to be on welfare? No, but I used welfare, and they won't tell you this. I used welfare to get almost everything I needed to get paid for. Now, I didn't have a debt at all, you know, but it was the digging, and it was the kind of pulling apart. I think one of the other things we're missing is mentors, and that's why anybody I see that is even have a pinky toe wanting to do anything in healthcare, I'm like, you go for it. You know, I don't care if you're just in there, you know, answering phones, you know. That's how I started, because you see, you admire. I was at Marin General working, and I seen this Black, I never wanted to be a nurse when I was a kid, a little girl. It never occurred to me. I didn't have this dream. I seen this Black girl, single mom, catching the bus from Vallejo to Marin to get to work. She got her LVN, she got her RN, and I just admired her dog. Like, she was like, then this may sound shallow, she pulled up in the Benz, and I was like, wait a minute, what's going on here? And she was like, what's she gonna do? And I mean, it just was like, you know, I, of course, was in love with healthcare, because you gotta love what you do. But I think we need to have conversations with our youth that if healthcare is even on the front back of their mind, even with the mental health, go for it no matter what it takes. Black people we're good at this. We are so good with going after what we want. But sometimes when it comes to stuff like this, there's a certain path, like you gotta go, like you gotta go to college. Like, you can't skip that part. You know, we get a little bit like, you know, maybe I'll just stay here and work, and just, no, you have it's a gift inside you. You need to push, and you need to go for it. I have a girl right now, I mentor a couple young ladies. I wish I had some young men to mentor, but I'm involved in the Black Nurses Rock. I see lots of Black male nurses, lots of them. And I give them a standing ovation, because when they come across patients that look like you and me, they are going to save their life, or at least try to. And they will be an advocate to that, maybe to that white doctor that will be like, nah, we ain't doing that. We need that. So I think it starts, and I think, John, you and what you're doing with your team, just getting these youth, getting their minds going, find out what their gifts are, getting them into healthcare is one of the biggest things that we have to have those conversations. My son said he don't want to have nothing to do with it. So I already tried.
Right. So
Like,
I think I think that's one of the biggest things that you said is, how do we advocate and how do we get the information? And I think that's what both sides of the conversation we've been trying to do, is have these educational series, because we understand that, you know, some of this important information that you need health-wise, or just in general, there is a cost associated. The problem is, we get African-American people who get their bachelor's degrees, their master's degrees, their PhDs, and then they don't want to come back and give nothing to the community. So we're trying to bridge that gap right now, to try to reach out to our healthcare professionals. We're trying to get people to put PowerPoint presentations to come back and educate the community, because for some people, that's the only way they're going to get the information, right? Some people not going to leave the hood, right? But if they see me or you and we come back and give them some game, that might be the light switch to get them kick started. So I think advocacy is very important, and you know, just reaching out to these Black student unions and trying to reach our kids young. I mean, we just don't get enough in our middle school, high schools, you know, encouraging them to get into medical, man. And it's a big issue. And then how do we legislatively, you know, fight for some of these restrictions to become nurses and doctors? You know, it's amazing that now we're in a pandemic. Governor Newsom passed a bill to kind of lower some of the restrictions for nurses to become nurses, or nursing schools to open up.
What restrictions?
It was, I got to go and look at the bill, but it was something that Governor Newsom signed. It was back when the pandemic first started, because they were so short on medical staff, and it was some kind of I read the article, some kind of holdup that they was having with medical students getting into nursing school, or something about the educational requirements. So he vetoed something to sign some bill to help this little loophole to get more students in the schools, or helping some of the ones that was in the schools get out early enough just to get bodies in there. I believe in the medical profession field, like apprenticeship, we need to have our students that's in the schools working in the field to get that actual hands-on, because the theory is great, you know, in the book, but we also need the hands-on. So how do we get these nursing schools to transform, to start getting some of these transitional students out in the field, gathering the information, working with the patient to help better prepare them for the work field?
Well, we're as a 2-year nursing student, I was out in the field. I will say this as another sidebar, and this is another discussion, but I have 2 felonies on my record. So I will tell people that tell me, oh, I had this and that, you still go for it. And they're not expunged. And if I had my license, I would show, you can Google me, because people don't believe it, you know, but the thing about the healthcare, you know, we are healthcare professionals, so we're seen as a higher, and James could attest, you are supposed to be trustworthy in a sense of, you know, and a law-abiding citizen. So there are certain things that you should have a certain criteria. But I will say, yeah, I have 2 felonies. They're still on my record. I went to nursing school when it was time for me to take my boards. They would not let me. The Board of Nursing of California would not let me. I had to go to Clay Street in downtown Oakland, stand in front of a judge and plead my case. And they said, okay, go for it. And that was it. And I think what they wanted me to show was that I was who I am now and not who I was, you know, years ago. But we do have hands-on. I do believe that the bachelor's program is unfortunately less hands-on than you're going to get as an associate degree, but they're not really, I don't want to say they frown on associate degree nurses, but of course, when it's all said and done, they're going to go for the higher degree. So I say just keep going. But I think that what you're saying as far as the hands-on and the mentorship, I think that and maybe it's me, you know, and this is the first time I've ever thought about me reaching back into my own backyard. And I thank you guys for having me on here, because maybe it's somebody like myself that needs to go to the high school and reach back and maybe completely guide a student or someone that's interested and walk them through their whole journey, you know, because it's going to have to start way back there, because I just think that in the college, you're going to get the tools that you need. And they do a good job in nursing school regarding culture. They have a whole section on us in one of these books about how we act a fool as patients, not act a fool as patients, but how you can't wash a Black woman's hair as a patient. You'd be surprised what you would see in these healthcare books about our people. Like you know how we say that's my auntie, but she ain't no blood relation. That's in the book. As a healthcare professional, we have to ask Black folks, now, is this Amy? Or is this your aunts? Is this your mama or your daddy's sister? Because we'll say everybody is our Amy, but it's in the book. They know us. You know what I mean? You'd be surprised. Do not wash that 70-year-old Black woman hair. Don't touch it. Because as a health, we're supposed to do that. We're supposed to wash you head to toe. They say, don't do that to her. So they know, and they're prepared for people like us to be healthcare providers. We got to go get it. We just got to go get it.
Right. So James, I know James got a question. I'm about to let James jump in here. Jada, the comments and the questions is going crazy. I see more questions and answers coming. Let's get to those after James. But I did want to say, Nicole, I appreciate you saying that, because a lot of times our Black youth and some of our Black adults think that because they have criminal passes or records that they can't do certain things. And I'm glad you said that, because that's opening up a conversation that we're going to have here. Actually, we have a couple lawyers we've reached out to. They are going to come back and educate the community on how to get these felonies reduced and off your record and pardoned. So please, you guys, tune in. We got some more great information coming up, but definitely powerful what you you said, because sometimes we do have these hurdles and these blocks that we feel like, oh, if I go do this, I got a past record. They're not gonna let me get an opportunity. So I'm just glad you said that, and that's very powerful. And then I'm just gonna go ahead and pass it to James, and then Jada, after James, let's go ahead and grab some of these questions and answers out there.
No, we're good. We're good. So I was just gonna piggyback on what Nicole was saying here, just about having professionals in the community. Like sometimes it is us just going out there and like you said, reaching back, or just kind of being engaged with the young folks. And I was used to when the pandemic wasn't happening, working in one of the Oakland public schools and one of the alternative high schools, and just being able to provide services for some of the teens in that environment. Right, but so they would see me there. I mean, we would talk, once a week or a couple of times a week, depending on what they needed. But that was more like me providing the service and not necessarily me talking about myself as a professional, although some of those conversations happen. I think that for folks who are familiar with mental health or just familiar with health in general, being able to provide some of what we call self-disclosure, just sharing with them what our backgrounds are and sharing a little bit more about who we are and like how we came to be who we are. Like having those conversations with the youth, but also with adults too. So I mean, they can all share the information, have the common knowledge, right? It's really important. I think when it comes to what is it going to be like for us to have more of those professionals practice in our communities? One of the things that comes to mind for me is, I'm not sure if it even still exists. I mean, maybe somebody that's participating in the call right now, I can reach out to some other folks. I remember back in like 99 or 2000, I'm sure it's still remnants of that are still going on. But in Cuba, they were allowing Americans, U.S. citizens, to go down there and train to be medical doctors for free. But the caveat is that you had to go and practice an underserved community for a period of time, if it was a year or 2 years, right? I think that if we were, and I have a lot of ideas about what it means for Black and brown folks to separate from what's happening in this country right now anyway, but for us to have our own, because this government is not going to give us what we want, right? I mean, I've heard Brother Travis Watts say this too, like we have everything that we need. It's not that we don't have it, it's being able to look at the resources that we do have and pull them together so that we can create what we want, but being able to work with, if we are going to work with the institutions that exist, then we have to, I want to say, earmark some monies for folks to not only be mandated, but to encourage them to set up practices in our communities so that everybody's benefiting, right? They're getting the wages that they want, everybody's getting the services that they need in the communities. But I think that some people might shy away because, if you're looking at Medi-Cal even as a mental health professional, and if my rate is at one thing, Medi-Cal might pay like an eighth of what I would actually take in, right?
Right.
And professionals are like, well, I don't want to do that often because I can't live in the Bay Area on $20 an hour for, what I do for in some instances, right? Or $5, whatever the thing is that they're going to be paying folks, right? But being able to create a blueprint for ourselves that's going to be beneficial for everybody. But we get to sit down. I was just looking up this guy that I remember sitting down with some years ago, Jeff Duncan Andrade, who has Roses in Concrete. It's a school in East Oakland. I'm not sure if you guys have heard of it. I'm not sure if it's even still going. I believe that it is. But being able to sit down with families and ask them what they need and not just kind of throw stuff at them. I think that what happened with politicians, that they just kind of say, well, I think the community needs this. And they create something, they just kind of plant it out there, but they haven't really talked the folks on the ground. So I appreciate what Nicole is saying, like when she's saying, like I've spoken to folks, I'm talking to people, and that's what needs to happen. Professionals need to be in the communities. These politicians, if we want to talk to them, need to be in the communities if we want to see that systemic change. But we're not having those conversations with ourselves, and it's not going to change.
Right. So Jada, I see the sparkle in your eye, Jada. I know you have a question. So before you take a question, Jada, go ahead and ask the question, because I see you ready to ask something.
I am. All right. So one of the questions that we have received is, what are some practical daily living things that we can do to shift our mental and physical health?
Some practical daily things. There's a lot, but I would say find out what a healthy ritual is for you. Know what it is that you're already doing well for yourself. That's what I often focus on with the people that I interact with, is finding out what your healthy habits are, right? Let's look at what your sleeping habits look like. Are you getting good sleep? I mean, sleep definitely has an impact on our mental functioning. Anybody in the room, I'm sitting here right now, can say, if I don't get enough sleep, I start to behave a certain way. If I don't eat well, I'm gonna start to behave. If I don't eat a certain amount of food, I'm gonna start acting out, right? Me, I know, like if I don't get a certain meal, you know, throughout the day, but also just what it means for us to be physically active, being able to have a routine, right, for ourselves consistently, and be able to stick to that and be able to monitor that in a way that's gonna be, I say, sustainable for us, right? Because if I know that I'm working, I'm just trying to be realistic about how folks may or may not be if they're working 2 or 3 jobs and you're not getting enough sleep. Like my availability for myself, my availability for the people that I care about is going to be extremely low, right? And in order for us to connect, in order for us to have a relationship, people need, I don't say need to be, but we can have conversations about it and say, hey, I'm not getting enough rest. Can you be a little bit more compassionate with me when on this particular day? You know, I did a 16-hour shift today. Like, can we back off on these kinds of conversations right now? Or, you know, what's looking at, and I say just the different levels of stressors that we have in our lives, being able to at least identify what those things are, right? If I'm looking at my life on a day-to-day, what are the things that are part of my life that are contributing to my level of stress? Because my level of stress compared to Jada's or to Nicole's or anybody here is going to be much different in how I rate that. But I can explain that to y'all and say, you know what, my experience of stress right now is like on a scale of 1 to 10, it's a 9, right? And we're trying to engage with folks and have conversations with folks about mental health. Like if I'm knowing that I'm functioning at a 9 and somebody else is functioning at a 2, that can we create some, how can I say, some agreements about how we want to be able to talk to each other, right? What availability I have compared to what availability I have. And I think that the other part, if I'm going to do it really quick here, is like, what do we do to cope? What do we do to really do to take care of ourselves? And I know that, you know, self-care is this thing that keeps on getting thrown around and what have you, but knowing what things are, if I'm going to go back to that rating system for a really quick second here, is that if I'm functioning at a 9 with my stress, what can I do to take care of myself that can bring me down to an 8 or a 7 or 6 or a 5 or whatever, so that I feel like I'm functioning in a way that allows me to thrive, right? If that means for me, I'm going taking a hot bath, that means I'm going to a good restaurant, I'm going to get my nails done, get my hair did, whatever that thing is, like how does that contribute to me feeling better about myself and how I move through the day? Right. I think that even just knowing at a really basic level, what can I say about this? At a basic level, how I'm functioning. I say that a lot, but I say basic emotional competence. Like, what does it mean? What does it look like for somebody to be emotionally or psychologically unstable, or like even creeping in that direction? Like, what are the signs? What are the symptoms? I'm not trying to get super medical about it, but even to say, like, when I'm experiencing stress, what does it look like for me? Do I become agitated? Do I slow down? Somebody's talking about, not sleeping right. Is it something having to do with depression potentially? But what does it look like for us to identify these things and kind of have the knowledge as we're moving through the days? So I hope that answers the question. I'm happy to talk a little bit more about that. But I say basically, biologically, how am I doing? Psychologically, how am I doing? Socially, how am I doing? Spiritually, how am I doing? Being able to take an inventory for ourselves and have some ritual around those 4 areas of our lives are really, really important.
Go ahead, Nicole, if you want to jump in and answer.
I think James pretty much covered it. I think self-care is important. And that just goes mental and physical. And sadly, I just think as a community and a culture, we do not put those things first. And that is why you're seeing some of the numbers that you are. We run until we can't run anymore. We don't provide respite to our mind, to our bodies, to our soul. No different, not separating the moms from the dads, but I'm a mom, so I know, so I'm speaking on a mom, but the day-to-day operations at the job, the dinner, the kids, and you keep going. I have a girlfriend of mine who has 3 small children. She's already has high blood pressure. The pandemic hit, the kids are home, she's working full time. She got dizzy. I'm like, it's your blood pressure. She went to the doctor, what did they do? They upped her meds. That is not what we should be doing, ma'am. That is not what we should be doing. We could talk about that later, the pharmaceutical companies that are making millions, billions off of us because we just letting them do that. But then again, we're not doing what we need to do to combat what these medications are helping us with. But her recognizing, like, I need to stop. I can't. But again, thinking that this has to be paid. I got to get to work. The kids got to do this. It's just, you really have to recognize when on this day, on every Thursday, or every other Thursday, I'm going to take 2 hours to do this, and then a reset. You know, you have to recognize that we are not robotics. We are human beings. We have organs that function. They feel us. Your mind, body, soul. The sleep is super important. And believe it or not, the older you get, the less sleep you require, but it has to be good sleep. You don't, you know, babies sleep hours, right? They sleep all day if you're lucky. But the older you get, you can sleep for 5 hours, wake up and be like, let's do it. You know, if you sleep restful. And that also goes with your mental health, because if you're toiling with how I'm gonna do this, and oh man, I got all these emails I got to check at work, your sleep quality is going to be less. And so James made a good point about that, because the mental health and the physical health, there is no separation. There is no separation for it. You have to have, both have to be cohesive in order. You have to take care of both of them. I always tell people who have, you know, like hypertension issues or whatnot, you can eat clean, but your cardiac strength you have to move. You know, your heart has to have that function. You have to get up, you have to move, you have to walk. You don't have to run a marathon, but you got to get your body moving. You could eat veggies every day and no sweets, whatever, but your body still needs that physical activity. Same as mental and physical. It has to happen. I'm begging people to take a respite. Those baths that we need by ourselves, just give me an hour.
If I can say real quick, I think that, so just to get back off what Nicole is saying, is that like that physical component is it cannot be overemphasized. And I say that and just even thinking about how we breathe, right? And it's like when Nicole was you just mentioned just like taking a bath. I think about when I sit down in a bath, like how my breathing changes to be able to put me into a state of relaxation, right? And I apply the same thing for folks who are trying to come off of substances and those kinds of things. Even before somebody takes in a substance, you breathe different, right? So I'm gonna have this beer, I'm gonna have this water, and you drink it, and you're like, that changes your whole physiology right there. Taking in one deep breath, and then you do that consistently, like that changes your whole makeup, right? So I would say, in addition to what Nicole is saying, just focus on how you breathe. People are like, I know how to breathe slow, I know how to breathe, but do you really? Are you really knowing how to slow yourself down? Do you really know how to take care of your mind when it comes to breathing? That's it.
Yeah, I love these conversations because you guys are helping me. I have the biggest problem with getting sleep. If I get 4 hours of sleep, it's like a great day. I have so much going on that if I get 4 hours of sleep, it's like that was a blessing, right? And then the good thing that you talked about, healthy relationships, man, that work-life balance is so hard for me. I'm so busy. I'm doing so much in the community, work, grandbaby, this. And it's like, I don't have that time. And, you know, I'm starting to, you know, the steps that you was talking about now, I'm like starting to identify some of the things, because like if I don't eat right, or if I'm eating out and the food's not that good and I don't sleep good, like I'm like messed up for a couple of days. I can't think, I'm missing appointments, I'm forgetting phone calls, I'm not reaching out to people. So definitely, that is definitely a great segue into our thing that helped me. And I know that also sleeping is the beds, man. I had a guy at Sleep Trade tell me, he was a doctor and he was doing that on his volunteer time to help sell these Tempur-Pedic mattresses. And he was saying, you know, people spend 8 hours a day at work. The second most time you spend in your life is in your bed, but we don't spend a good quality bed, you know, because a good bed, you got to sleep good. So definitely with that sleep comes a good mattress, man. I'm telling you, makes a difference. Jada, we got more questions, Jada.
Yes, we do. And before I ask the next question, I'll just say what Nicole said about us not being robots. That's something that I feel like we all hear. And I know all the time when I'm in class and my professors are looking at us, they're like, you're not robots. You must, you know, you must take care of yourself. But then, you know, then they assign like 10 assignments due at the end of, you know, you know how that goes.
They do.
But I think it's very important what both of you were touching on about really just checking in with yourself, because I know it can be like very hard when you're really on the go day to day. And so the next question.
Before you ask that question, I'm sitting here and I'm thinking, because, you know, I always got to think of both sides of the conversation.
Oh no.
Yeah. So, I mean, like, I hear the solutions, right? Like I like this conversation because it's solution based. These are some tools that we all can use to heal. These are some tools that we can use to take personal inventory, to making sure that we're okay, right? Because there's something that I heard my grandmother say a long time ago. It was called, she said, physician, heal thyself, right? Meaning that the body naturally is the physician and it tells you when it's going through whatever it's going through, right? How do we expose? Because I think exposure is the keys to a lot of things in opening up minds and getting people different perspectives and different viewpoints. How do we expose this information to our community? Like in a way to where it changes our social construct? Because I think our cultural, our social construct needs to be dismantled, like the police department, right? Like, so how do we dismantle some of this stuff and expose folks to this information so that they can have this? Because this is like gold. Like you guys are like this is like real gems that y'all dropping, and I'm taking everything in, and I'm gonna make sure that I help John with getting some sleep, getting some rest, so he's not stressed out. But how do we give these gems to the community? Like, because this is a treasure chest y'all just gave up, and you know, like I want to give it, and I want to figure out ways on how.
This is your bigger question. People have to have the desire. This is where the bigger question about this whole, even with the whole grocery store thing, it's like, we Black people, we got that dog. We know how to go get it. We have to have the desire. How many people on this line right now know somebody that got diagnosed with diabetes, hypertension, took the diagnoses, popping the pills, and going on about their regular day life? We know somebody. We do know people too that took the time, and like you said earlier, Rico, championed that information and turned it around. But what do we do about people's desire for better? I believe that's where you start, because I can go speak to 500 people right now, and either they're gonna have the desire to say and take the gems, or they're gonna be like, nah. My dad was just living with me. High cholesterol, smoker, but the whole caveat. I'm like, Dad, like, you know, the Rona's out here, you smoking, like you kind of in that, you ready to just get us all up? Nah, I'll be all right, you know, but afraid to get on a plane to catch the coronavirus. I'm like, you smoking cigarettes every day. I'm like, I don't understand. You probably have more chance to get lung cancer. But how do you put that desire in? My dad's only 63 years old. He looks like he's about 79. How do I get people like him, to have the desire to say that health and health care is important? That's where I feel like my fight is, man.
So quick question. So since we know, like I look, so like the way I view things is a little different. So like, I mean, I do understand what you're saying, and I think you're 100% right. But we know, like, systemically, the system creates these things and put them in our path and in our community systemically, right? To where if we know this wheel is spinning, like it had a turn, but now it's spinning, it has its own momentum, right? So like if we, like the access I'm talking about is like revolutionary, right? Like how do we revolutionize all of the work, right? Because I believe in Black space, I believe in Black community in all occupations, and it being 100% segregated again, where it doesn't leave room for option, because we have created systems where this is the way now, opposed to the way that we were taught. You see what I'm saying? Like, because some of this stuff is taught to us, and we, like the chitlins and all that stuff was given to us as slaves, and we just kind of followed those traditions, and now it's a part of Black culture when it's really not. It's slave culture, right? So like, how do we like change that whole narrative of thinking to revolutionary because I know because what you're saying is 100% right, but I'm trying to figure out like how do we expose folks to just like like anywhere you go, like there's a Black community that has everything Black. Like, because I was in the Asian community 2 weekends ago fighting for there was a Asian lady like 87 years old in New York. She was set on fire by 2 young dudes who tried to rob her or whatever, Black young dudes. And I went in and I wanted to support the Asian community because I stand against any violence. But we're people of color and we need to support each other. So I went, and as I'm in Chinatown, I recognize every last thing in Chinatown is Chinese. Everything from their housing to their psychiatrists, nail shops, food shops, even a whole hospital, all Asian, right?
So you want us to build like a Wakanda?
That's what I'm thinking is how do we, I think that's part of the solution. Like, how do we create those spaces where it's not an option because the Asian community dictates their culture because everything when you walk in Chinatown is Asian. And like, and we learn sociably. Like that's how that's our first learning tool is through our social environment. So like, how do we do that? Like, I need help with it. Come on.
But Rico, see, you gotta understand. But you have to understand too, Rico, that systemically.
Come on, John.
Listen, listen. I'm gonna be honest with you. Systemically, the black people have been attacked so many ways. So it's hard to put us to the same standard as the Asian community because the Black community has always been a threat to the United States government, to the government in general, right? So every time we've tried to unite and do these things systemically, we've been attacked through different things. Like they said last week from the Black Panthers, COINTEL, just different things. The stronger we try to become, we have more opposition. Whereas the Asian community comes to America and they don't get that opposition. They might have their struggles and their challenges, but they don't get a continued systemic plan to dismantle them. You get what I'm saying?
They're not considered a threat.
Exactly.
Why are we the threat to build in that fashion?
I think
because
James
we are the
said
true,
James
we the
said
true,
it. James said
we are the
somebody
true
told
people
him
of this
that
land.
It's up
That's
to
why.
us, John. James said it. I don't remember who told you that, James, but somebody told you it's up to
And he
us.
wasn't the first person. He wasn't the first person. Let's be clear. I think that it's been happening for a long time where we have been able to, there's been certain parts of the community that has been able to separate. And I think that we, as a people, we've been traumatized in some ways. I think that what I think that John is saying is that we've been traumatized because every time that we do make an effort to step up, either the government or somebody else steps in to tear us down. So we're like, it's not to say that every part of the community has given up, but there has been this, it's intergenerational, who want to call it. It's been passed down to us to say, if we try and build something, somebody's gonna take it away from us, right? So why even try in some instances, right? But it's not true. We get to beat back the myth that we are more powerful, that we're not as powerful as we perceive ourselves to be. In fact, we're more powerful than we perceive ourselves to be, right? But we do have these opportunities to start, let's say start small, but we have to sometimes shut our mouths to other people and tell them what we're doing, right? Everybody don't need to know what we're doing all the time. We want to keep the folks that want to be able to build, and the folks that don't want to say, okay, maybe eventually you come on board, but to find those unique folks that actually do want to participate in those systems to create what we want to be able to create for ourselves. And I think that when we have that economic power, I was thinking about, what's this guy's name? John Claude, I forget his name. He has a book, Powernomics.
Yeah, I know you're talking about, yeah.
I mean,
Dr. Clausen, yeah.
Dr. Clausen, thank you. So being able to create our own, we gotta have the economic power, because I think that China is a threat, but because they're a threat in a different way. They're an economic threat. They're not a cultural threat, right? I think that because they have the economic power, they can do pretty much whatever they want to, depending on what they are, but they have the community economics to be able to make those systems work for them. And Black folks, I don't think, and brown folks as a community haven't necessarily done the same kinds of things. But it'd be great to have a Wakanda right here in Oakland or somewhere for us to do that. Who's going to put those blueprints together to make it happen? Again, I will go back to doing it block by block.
I mean, when you look at it, when you look at their communities, I mean, even in San Francisco, I've worked with young people, maybe like, I think it was 10 years ago, and we were taking young people on tours of different schools and or whatever that's outside of private, public schools. And when we go in private schools, they're exposing their youth to the trends of today. They had a whole they had classes for third, fourth graders that was 100% geared towards tech. Their high school students, ninth grade, they're talking about being a doctor, nurse. They're exposing them things that our young people aren't being exposed to, and then our young people are being exposed once they get to college, and they don't have an idea on really what they want to do, right? So to me, it's like, how do we? I mean, I know it can happen. I know it can happen. I believe it can happen, even if they're gonna tear it down. Oh well, let's just make it happen. John, look, stop being negative, John. It can happen. It can really, really, really happen. I mean, like when we look at Atlanta, like T.I. said, that's Wakanda. He think it's Wakanda in his head. He's like, that's Wakanda. I mean, but it's a lot of black people doing things that's, you know, for black people. So like, how do we create that in a lot of urban communities where we are dictating our education, we're dictating our health, we're dictating everything in our community? Because I like right now, it's not happening, and they're going according to themselves, right? When we look at our health, what studies? I mean, I know they've done a lot of studies on us, but most likely those studies are counterproductive to us if we don't trust them. I mean, like I think that's part of the trust issue. Also, it's like, you know, you know, John, I know you don't think it's gonna happen, but what's the solution?
Well, I mean, the thing is this, Rico. A couple of weeks ago, you talked about it. It was the most important thing that was said, right? We have to teach our young Black and brown community the history, right? To like James said, to empower us to know that we are the chosen people of this earth. We are the God. Our women are the gods of this earth. It starts there to empower us because of the damage of slavery, the mental, the physical, all the things that they traumatically did to us. It's affected us. So we can't trust each other. We can't do business together. We can't live with each other. It's the self-hate, man. It's just the self-hate that was put on us, and you see it today. We still can't unify, right? All we look around the news, all we talk about is the $1 trillion that Black people spend, but we still are the poorest people in this country. We spend more than we invest with each other. We don't circulate our dollars, right? Because we don't see it. We don't believe in the impact that we really have. So how do you empower people who don't even believe they have impact? Because we don't look at the avenues that we need to go to actually promote sustainability. So everything that we see is short term. And so the education part, empowering the people, is where it starts. I mean, you have a culture of people who are fragile egos, low self-esteem. We have the most beautiful sisters, the beautiful brothers that's doing great things, and they still, like, you talk to them and they all dealing with esteem issues, right? So we don't have the confidence, right? What comes with that you know, the empowerment part comes with that understanding that you have is the confidence. We don't have that confidence. We have money, but we don't have confidence. And then as a Black culture, we have to get out of, the only way we gonna make it out the hood or do something financially is through singing, sports, and arts, and comedians. Like, we as Black people have to fight just as hard as we fight for sports and music. We need to fight for those technologies and those medical things that we need in our community. And it's just not happening. We promote everything through sports, music, arts. Like, that's the only way as Black folks we gonna make it. Not saying that we don't have a large population of people that are doing it, but in the urban communities, that's what they get promoted. Like, the only way you're gonna make it is if you're a rapper, or if you're a football player or a basketball player. We don't see the multi-million-dollar tech Black dude that's a tech guy that's coming up to the hood talking about, I'm jumping out this Lamborghini because I just created a tech app, or I just coded something that paid me $200,000. So Black people, we are a show me type of people. We have to see it. So our young people need to see these multi-million-dollar Black techies coming to our community talking about tech. Like, look, I do tech.
Right. I think you're right. And I think that I actually was at a elementary school in San Ramon, and I was on a panel right before the pandemic hit, So we were talking about the coronavirus, and there was a young Black guy. I don't know, he was really young, but he was a scientist. And it broke my heart because in this sea of elementary school kids, there wasn't really many people that looked like him. You know, it would have been so much more powerful. Granted, they got to see one brownie, the other brownie, but African-American, young. I mean, this guy said he would play with, he was just given that whole scientist vibe, that he would do this stuff at home as a kid. And he was just a young guy, and he was just like on fire. But it's unfortunate that and maybe I'm wrong. Maybe he did go to another school in the other communities. But to see him there was like, wow, I wonder what our children would see and think of themselves as they look at what they're going to do when they transition into adulthood, if they saw somebody that just looked like them.
It's I get chills and I get scared thinking about it, because it's a daunting task, right? It's a daunting task to be able to have the impact, to have the influence. I think that the blueprints are there. I think that there's so much to it. It is a marathon, right? And I think that Black folks are scared of marathons. I think that some Black folks are scared of putting in the work. They're scared of what it means to do some of the long-term things. Not to say that everybody's that way, everybody in the community is that way, but to see somebody to walk in line, walk in step with somebody as they're doing their marathon, people start to get up and say, "Oh, I can't do this for this. It takes too long. It's not happening as quickly as I want to." I think that's what kind of trips us up with some of these kind of get rich quick schemes and those kind of things. It was like, "Oh, I can do this real quick and get this money," but it doesn't last very long, right? Like, what's it like for a young person to see someone? I mean, if it's going to be mentoring, or the mentoring piece is very significant, is being able to walk alongside someone who is not going to give up on them for whatever period of time, right? If that's going to be for
that's true that you say, that's that fast money, and the health goes into all that. But like, my son's a junior in college, and he just really makes me want to strangle him sometimes, because he'll slip up and he'll be like, "Mom, man, if I was just working." I'm like, "Working where? Working where? Where are you working?" But he sees his peers.
Yeah.
He goes to Nevada, all his friends, every friend he had out here. And I've read Rich Dad Poor Dad. I know that traditional education is not always the way for everyone.
Mm-hmm.
But he has a free education, so you're going to get that.
Mm-hmm.
You're going to stay there. But he sees his friends, working Amazon. They got this little. I'm like, dude, this is little money. They don't even have a place to live. They're homeless. Mom, and they live with their mom. They're homeless. They're homeless. Okay. You have to be able to provide. 20, 21 years old. But he sees that, even he's a junior in college, and even still last week on the phone with him, "Mom, man, if I could just get a job." I had him do the math. Do the math. And your education is priceless. And you didn't pay a dime? Are you serious? But it's that glitz, the glamour, the shoes, the cars, and let me get this fast. And I said, and guess what? Fast, when I was hustling, I remember, fast money go fast. Didn't have a dime, didn't have nothing to show for it, out here hustling. Mm-hmm. It goes fast, but my sweat, tears, getting up at the crack of dawn, going to school, then going to work, that money is some long money. Yeah. But that fast money, yeah, but like you said, it's just, and then you need the voices, and I'm proud, we do got some, especially the men, we got some nice male role models out here that are at arm's reach, even if we just listen to them. I love Les Brown. I listened to him myself when I was locked up. E.T., Eric Tom. They just get you fired up, and I send those things to my son. I send them to his friends. I'm trying to tell them, like, you guys can do whatever you want, but it's going to take work. Like, it's just going to take work. And guess what? When you do what you love, you'll never work again.
Yeah, that's true.
You do what you love. But I think James had a good point. Our community, and I wish I knew why that was, is that we're in this fast lane of like,
Instant gratification.
I don't know.
You said, John.
So Jada, I got a question for you. Jada, how many people in your class look like you? Now y'all know, if y'all don't know, Jada is like about to be at NASA. She's going to the moon, so she's very smart. I just want to know how many people in your class, Jada, look like you, are brown or black. Your mic is off.
I would say in my class, especially since I'm hitting upper division, and my major is physics, it's less and less the higher I go. So in my general ed classes, for sure, I saw a lot more. And when I say a lot, it's really not a lot, but a lot more people around me that look like me. But the higher I go, no, it's less and less.
Yes. See, that's the problem, man. And that's something that we gotta work on to get there. But yeah, we behind Jada supporting her. She's gonna be that black woman going to Mars, I think,
Right.
somewhere. NASA's gonna take her somewhere.
Yeah, go.
She gonna find
there,
Wakanda for us.
as soon as you get up there, do the Wakanda, put your fist up. Yes.
Exactly. And let me say, I won't go because I don't know, I'll help people get there. Let me say that. I won't go. I won't be the astronaut, but I'll do the calculations to get you there.
All right.
That's what's up.
All right, Jada, let's grab some more questions. I know there's a couple more out there that we didn't get to answer. I'm seeing a couple people in the group chat. It looked like Deja responded, said she's looking at trying to open up a grocery store in her community. A lot of people are agreeing with James about the breathing techniques. They talk about meditating is something that they found that's working. So that's cool.
Yeah, and sorry, John.
Go ahead.
So another question that we got is, how do we trust white therapy? How effective is talk therapy while doing Zoom?
You're asking me? Yeah. My word for the day is relationship. Right. I think that I don't know that there's going to be any, even among Black folks, even among folks of color, I don't think there's going to be anybody that's going to completely understand your experience. It's nice to be able to connect with someone who has a similar background when you're talking about mental health or even physical health, or talking about spiritual health, like somebody who can relate to you. I think that being able to, it can be challenging to trust somebody who doesn't look like you. If it's a white therapist, if it's an Asian therapist, whatever the person, their exterior is, I would be curious to, and engaging with them, what are they willing to learn and what are they willing to be curious about with me in that session? And are they able to put that aside as I'm trying to work through whatever it is I'm trying to work through, right? And what I mean by that is that there is a medical model, and I think that Nicole can speak to this. There's a medical way of doing things, and it can be a holistic way of doing things, and it can be like whatever you decide to do to get the results that you want, right? And it's not uncommon for a lot of white therapists to kind of be by the book and not really dig into the cultural pieces of like who we are as a people, right? Or who other people are as they are. But there's only so much you can get from a textbook. And in the same way that Nicole was saying that they say that, you know, when you got to ask folks, like, who is this to you? Like, is this your auntie or is this your auntie? You know, who is this person? To have those conversations with folks is really, really important, because I can make a lot of assumptions, even as a Black therapist, about who this person is that's sitting in front of me, right? They can say that, oh, I'm from South Side of Chicago and I did this, that, and the other. But if I don't really try to get a chance, if I don't make an effort to understand who you are and why you make the decisions that you make based on what your history is and your experiences are, then I'm not going to be able to work with you no way, right? I think that being able to understand where this person is coming from and genuinely be curious and help them to make some connections for themselves is to be able to, to do that. I think that it's going to be hard to trust somebody who doesn't look like you unless they want to engage with you. If they're white, Asian, whatever, but I think it's especially hard for Black folks, given our trauma history with white folks in general, right? To be able to sit down with them and say,
too, though, James, do you feel like, because I noticed that some Black folks don't like to be vulnerable with other Black folks that are in professions. So if I'm coming to you as a counselor, maybe I now, especially men, I don't want to let you know maybe something happened to me in my childhood and I just can't, you know, it's so many caveats, especially when you're dealing with mental health, physical too. And I'm sure we'll talk about that, but mental, sometimes you got to get to the root. Well, most of the time you have to get really to the root, and that requires so much vulnerability. And I think as a people, it's hard for us to be vulnerable with each other. Now we're going to say, how do we trust the white therapy? Do we trust our own people?
Mm-hmm.
Do we trust anybody?
Yeah. You trust yourself. Right.
So my
You know,
question is, I want to jump in there. So my question is this, and this is just for the mental health and some of the physical. Me and Rico are all in all of these meetings, right? So right now we have all these nonprofits, all these psychologists, all these people advocating for funding for their programs. And I always have the question, all we hear about is mental health, mental health, mental health, but our people ain't going to get it. So how do we reverse the conversation in a way that's going to get our people attracted to get that help? Because we got a million people who can identify the problem. It's mental health, it's mental health, it's mental health. That's all I hear. And how, you know, and how do we get out of the reactive mode and do the proactive? Because in Black health, it seems like we don't want to listen, we don't want to hear nothing, we don't want to go to the doctor until we almost die or it's almost too late. So we don't do anything before. You know, it's all reactive, right? And then like Nicole was saying, like, I have relatives I went to the doctor with, you know, they got medical issues, but then they lying to the doctor. Do you smoke weed? No, they smoke weed. They got all these issues, but it's like, it's that, I'm telling you, it's that mentality. So you can't help yourself if you still like, I don't want to tell them this because they might tell on me, or they might turn, like your doctor or your whoever, your nurse practitioner, whatever, that's supposed to be the person you can open up because this is your health. But it's time and time you go in there with Black folks and it's like they lying. It's like
you can't, if you can't be vulnerable with your spouse, your friends, your family, I just find it hard to believe that you're gonna, you know, be vulnerable to a healthcare professional. And that is really, really unfortunate because like when my dad, that lady asks, is how many packs of cigarettes a day you smoke? Simple question. Oh, maybe a couple a day. I'm like, no, Dad, you're lying. You're lying. And you need to stop. And if you don't want to quit, that's fine. But you can't make a general, your blood pressure is through the roof, man. She know you smoking. Quit lying. But, you know, I think to go to your question, John, it really starts, and I'm just taking a long shot, is our family, our inner family, like mom, dad, siblings. Like how many of us were honest and open with our parents? Something happened. I don't feel a certain way. I'm not comfortable around this person, or something happened. Were we comfortable with going to mama and dad and saying the things that was really bothering us? Did we have that open door policy in the home, right? Because if you can't speak to this nucleus about, I'm stressed out. I remember when I caught my case and I was all in the mix, I didn't tell nobody. And when I was about to get locked up, here I was, and all my family kept saying was, Nicole, why didn't you tell us you needed any, you know, like, why didn't you say something? Embarrassing, like, who, do we have that? Is it really in our own homes that it starts at? And you guys, I'm sure some of y'all have children. Do your children, are you their confidant? Do you feel like they come to you for any and everything?
I think they don't. I mean, I think for my generation, I did a better job of having a little bit more open conversation with my daughter, and it changed just like not being upset. So she has opened up to me about a lot of things. But I think you touched on something earlier, Nicole, that I think is a big part of it. When you talked about religion, I think religion is really one of the big components to why, you know, our Black health is affected. I mean, I'm just being honest. I got a grandmother, 99 years old, and well, all she talked about was, I ain't going to the doctor. They gonna kill me. They gonna put something in me. I've been making it this, you know. And then we go to our old slave ritual, just give me some Epsom salt and I'll be fine, you know, or just give me, you know. So, and I think a lot of it is religion. You know, we have like religions that don't believe in blood transfusions, don't believe in scientific help. And I think the religion has played a big part of the hurt of our educational piece. And on top of just the community thing, and the Black Panthers touched on it last week about how some of the things from the health system did purposely, intentionally affect the Black community. So, as Black folks, whenever we become damaged or that trauma does stop us from, trusting again. And I think that was more of this conversation I just wanted to figure out, from you guys as medical professionals too, is how do we help heal that? Yeah, it was a time, but right now more than ever with this COVID and all of this stuff going on, we need our Black people to go get seen. I mean, people are scared to take flu shots now. I mean, because they got a misconception that they're going to inject them with the the COVID vaccine. So yeah, we got to figure out how we could do that, and I'm just glad to be able to have you guys kind of get some different thoughts. But Rico, what do you think?
I mean, I think a lot, but I think definitely we were made perfect, right? And I think in us being made perfect, we just gotta think about a natural way of eating, living according to a natural way of living. I do think that if we don't put spirituality first, in some capacity, it do keep us sick. Religion and spirituality is two separate things, but I do believe that people do need to be in tune with something that's greater than themselves. I was one of the people who was real honest with my mom growing up about my stuff and how I felt, and my mom, she didn't accept what I was saying. She did not accept none of that stuff. She like, no, but luckily, when I was incarcerated, a lady came in and she was talking about mental health. And I just liked I liked the term mental health. Like it made sense to me, like, oh, mental health, cool. But when she came in and she was talking to the inmates, she was talking on master degree level, right? Where a lot of the stuff she was saying, I was confused. I didn't know what the heck she was talking about at that time. And then afterwards, I had enough courage to ask her, like, can you explain this to me in layman terms where I can understand what you're saying? And then she said, Rico, well, do you like to work out? And I'm like, yeah, I love to work out. And she was like, so what's your favorite exercise? And I'm like, push-ups. And then she said, well, mental health is the same thing. It's like you doing push-ups in your brain to burn the fat and burn the grease off your brain so you can have a healthy or buff brain. And then she was like, do you want to have a buff brain? I'm like, sure, I want to have a buff brain. So in doing that, I ended up seeking mental health when I got out, and coming to find out that what I was telling my mom was plaguing me. Like that was one of the main issues that was at the core. And for my mom, she seen it as a minute issue when I seen it as a big issue. So it's super weird, and I used to be embarrassed about it. But my sister, she was, so I was born 81. My sister was born 82. I'm March 4th. She's March 17th. So when my mom was 6 months with my sister, she put me down and never picked me back up. I didn't get breastfed again. I didn't get my love no more, And I had an issue with that for a very, very long time. And I told my mom about it, and she was like, you just jealous, you're tripping. There's no, that's your sister. I'm like, so what? I missed my time. Like everybody had 2 years, 3 years span of just you. I got 6 months of you, 7 months of you. I feel some type of way. So when I went to the therapist, that's when they found out that I had abandonment issues, and the abandonment issue started right then. And then my father leaving, then that's more on the abandonment issue, and it goes on and on and on and on. So just to Nicole's point is that honesty is important. And when you do have a kid that is honest with you, how do we as parents accept it, right? And not just saying, I'm the authority figure. I don't want to hear that. I'm doing the best that I could do, right? But being able to modify the way that we were taught to teach a different way. Because that's something that I struggle with a lot is, as a parent, I was raised a certain type of way by some amazing women in my life, grandma, aunties, that were very, very strict. They were very, very firm, and it was a certain type of way. And I believe in that same way, but it doesn't match with today's way. So, and I struggle with, and that's something that I struggle really hard with, and being able, especially I got 3 boys, with my sons, and like really just, you know, I try to have those conversations, but it be them points where it be like, you know what, I got to put my foot down. I do not care, which creates a certain type of fear, even though I don't whoop them, but like it's I guess it's a natural fear that they have, but I don't want them to fear me in that way. You know what I mean? Like I want, because sometimes like I'd be like, well, why you didn't tell me? And then I can look at him and tell he didn't want to say nothing, or they didn't want to mention it to me because the fear of me being upset. And it's like, just get over it. I mean, like let's get it out the way. You know I'm gonna be upset, right? So, but and I find out anyway, and it's like, dang, like how can I like modify some of those techniques so that they can be honest with me? Because my fear is them going through something and they don't tell me, and it can be really harmful to them, and it might cost them incarceration, or it might even cost them their lives. So, you know, and I think all that is a part of health. Like I think that, you know, like how do we look at the whole entire child, and you know, and I be looking at that type stuff. But like as a father, I'm not perfect, but I do strive for perfection and trying to figure out like, how do I get my boys to a point where I know that they're gonna be successful and I know that they're gonna be okay. But with this fear, man, I don't know. Like, I mean, I want them to have reverence for me, and you know, like see me in high regards. Like, okay, that's dad. I respect him, but I don't want to see the fear. Like that fear is like, why are you scared of me? Like you ain't never got a whooping in your life. Like, you know, I had a genuine fear of the people who raised me, because they whooped my butt. Like, I mean, like really whooped my butt. So, you know, I think, yeah. So, Jay, do you have any tools that I can? James, do you have?
Absolutely. I keep saying this word relationship, man. It is key. The relationship, the trust, the respect is key. Being able to understand somebody's process. And that goes back to, I'm going to throw this out there. There's 2 things I'm going to throw out. One is the stages of change. And the second thing is motivational interviewing. Right. So I mentioned the stages of change first because it has I think there's 6 stages altogether. Right. And I use it a lot for folks just being able to understand on a real basic level, like what it's like for somebody to go from a place where they're in denial, like Nicole was talking about, her dad was like, I ain't smoking this amount of cigarettes, to this place of maintenance, right? And then potentially going back and relapsing into something, right? So I'm gonna say the stages really quick here, and then I'll just describe what they are, then I'll talk about the motivational interviewing part real quick, right? So the stages are the pre-contemplation, contemplation, planning, action, maintenance, and relapse. In a pre-contemplation space, we're in a space where we're in complete denial that anything happens, is going on. If I'm gonna use your dad's example for a moment, Nicole, just to say, like, he said, I ain't smoking, ain't bothering me, ain't bothering nobody else. Those would be the statements that somebody would hear in that pre-contemplative space. In the contemplative space, somebody's saying, you know what, I'm smoking a little bit, but you know, maybe it's impacting me, maybe it's impacting somebody else, but I still don't want to do anything about it, right? Planning is, you know what, I'm smoking this many, you know, packs a day, you know, like what am I'm thinking about making some changes, but I don't really want to do anything yet. But what are my options? What can I do different? Tell me what I can do. I don't want to think about it on my own, right? Action is, I'm going to take one of those options and I'm going to try it out. I'm going to try it out for a day. I'm going to try it out for a week. Look like we lost Nicole. I'm going to try it out for a certain period of time. And then that maintenance is, I found something that works for me. I want for that thing to stay consistent for me. I like the way that it feels, right? The relapse is I go back into one of these other stages that either is planning, but people rarely go back into a pre-contemplative space where they're in complete denial. They just kind of wrestling around what they want to be able to do, right? I'm gonna bring in this motivational interviewing piece because it's important. It's like when we're talking to our children, right? It's being able to say, so what is your process of understanding who I am as your dad? Talk to me. Let's have a conversation about how you feel when you talk to me. If I'm your mom, what are your thoughts about you talking to me? Let's have that conversation when you of age, right? But being able to say, hey, I'm gonna tell you what my process is when I'm speaking to you, young person. I was like, I care about you. I love you. I want to see you make great decisions. I know you're going to mess up sometimes. And that's okay to mess up. Nobody's perfect, right? We are created perfect. I'm going to go back to what Rico said. We created perfect, but we still slip up sometimes. And what's it like for you to acknowledge when you made a mistake? But what is it like for you to learn from that mistake? And that's why I'm here as your parent. This is why I'm here as your mentor. This is why I'm here as your fill in the blank person, right? How do you learn from what's going on right now? Because you fearing me, how is that helping you? If you're afraid to tell me something, if you're afraid to tell somebody else something, how is that helping you? At the end, I say at the end of the day, or just for today, right? How is it going to benefit your life by not sharing this thing with me right now? Are you holding on to it? That's fine for you to hold on to, but how likely is it that what you're holding on to is going to grow into something positive? What's going to grow into something that's going to tear you down? Let's talk about that for a little while. Let's sit in that discomfort. Let's sit in those moments, because it's like, I don't like talking about this. It feels bad. Okay, we're gonna sit here until we come up with something that, I mean, if it doesn't have to happen all in one sitting. I want to be compassionate in that way. And so you don't have to talk about it all right now, but we need to have a ritual again of having these conversations where we're talking about what's real for you and what's real for me in this experience. Because if I'm just checking in with you when things are going wrong, then you're gonna see me in my anger space more often. Right. But if I'm having these conversations with you, I'm talking about a weekly conversation, bi-weekly, you're doing camps, like this has become a normalized conversation that you're having. The likelihood that I'm going to share these things with you is going to be increased that much more. Does that make sense?
It makes total sense. I took notes on everything you said, so I'll be able to, I'm going to try to practice some of that tonight.
Well, Jada, we got a couple questions in there. I see a couple in the question and answer. Yeah, we lost Nicole.
We did, yeah.
Either she got kicked out or her phone died. Something happened. I'm sure she'll try to get back on. We're getting close to the end here anyway. It's 3:43. We got about 15 more minutes. You want to pop out a couple questions for James?
Yeah. So one question that we received was, is it money that keeps African Americans from mental help from African American professionals?
I would say sometimes, yeah. I think that depending on which programs are available, like for Medi-Cal, I know that it's basically free, but you got to find professionals that are taking Medi-Cal to do that. It's not to say that they don't do it. The difference sometimes is, and this is where I think that, and at least from my point of view, this is why I stepped away from some of the insurance panels, is they want you to practice in a certain way. And it may or may not be beneficial for what this person needs. It's not to say that the practices are not going to be beneficial in some way, but I'll put it in this way. I think that Nicole can relate to this, is that, and I'm sure you guys can too on some level as well, is being able to say there's a lot of diagnosing that happens, like labeling that happens in mental health. That scares people. Say, oh, somebody's got bipolar disorder, oh, somebody has depression, oh, somebody has PTSD, and that becomes part of their makeup. It becomes part of how people see them, right? And I don't know that a lot of folks like to be labeled. Somebody likes to be labeled as angry, somebody likes to be labeled as dysfunctional, what have you. Then I think that some of those systems of care kind of promote those labels and not being able to say, well, you're not this label. Like you're not bipolar. Like you are not depressive. You're not a depressive. You might have some of those symptoms, and those symptoms can be addressed, but that's not who you are. Right? The same way when somebody says, well, I'm just an angry person. Well, we all get angry sometimes. That's okay. But you yourself are not anger, right? You yourself are not this thing. It's something that I share with folks often, is that it's something that passes through us. But to go back to the original question, is money one of those things? Sometimes, I would say. I think for a good number of folks, it definitely can be a hurdle for some people. It's not to say that there aren't some, I call them like scholarships, and people who are doing some lower fee options. I'll just ask the professional and say, hey, are you willing to take on a client that is able to pay this rate? Because I think especially in California, I'm sure other places as well, where there's a sliding scale fee that they'll offer for their practices, for their services, and that makes it more accessible, right? And there's some folks that are doing it pro bono. It's like, I just come in if I have a slot, and then we'll make it work because I see that this is really going to be beneficial for you, or to find other ways. I mean, it's nuanced because there's individual relationships that can be done for therapy, and then you can do group settings, and some of those group settings are free, right? I think I participated in a few spaces where Black men specifically can jump in and just kind of have conversations with other Black men or Black youth, and that's free. It's just a way to be able to get things out, right? I think that those, being able to look at what healing spaces are and not think about it just as being something that has to be connected with the government or being connected with a specific therapist, being able to look at, you know, the different even healing spaces, if that's going to be a poetry or the gym or whatever, like what does it look like for these things to be contributing to your mental health? And if there's something specific that you need to work on, then it's nice to have somebody that has a specialization that can work with you. However, that doesn't have to be the only way.
So I see Nicole reached out. She said she lost her internet connection. So I guess she'll try to get that up and get back on.
Okay, we also did receive another question as you were answering, James. So the next question that we have is, what approach do you propose Black people take to seek mental health services under these conditions?
Can you read that question for me one more time? I just want to make sure that.
Yeah. So it's, what approach do you propose Black people take to seek mental health services under these conditions?
First, I would reach out to reach out to any mental health professional just to even get a consultation, right? I think that, so there's a good number of folks, myself included, who will offer free consultations for folks. And it's not to say that you want to hop around to like 20 different folks to get your 20 sessions in for free, right? I mean, it's as is possible in a way, but the progress that you make is going to be somewhat limited. It's being able to say, you know what, let me at least develop a relationship with someone. Let me find out if it's going to be a good fit for me. Right. Just reach out, call them up, look at their bios. I mean, there's platforms like Psychology Today. There's a lot of online, what do you call these app-based services as well. I think so. Ayana Therapy is spelled AYANA therapy.com. It's focused specifically on Black folks and people of color. Therapy for Black men, therapy for Black girls, therapy for Black women. Those sites allow for you to see some of the profiles and some of the techniques that that professionals are using, and they specifically target people of color and just Black folks and brown folks and Asian folks too. I think that when you look at Ayana Therapy, I think they're all inclusive. You know, queer, trans, bi, gay, everything, like everybody's included in those platforms, right? So being able to look at like what you need, I think is one way to be able to insert yourself or to be able to be more informed about those systems. Like call people up and just ask them questions. Like, hey, like, what do you do? Like, who do you work with? Like, what are the approaches that you use? Like, how many clients do you see that look like me, et cetera, right? And find out what they charge. And if they're not familiar with, or not taking certain insurance things, like what options are out there that they can use if they're aware of them. But don't sit back. I mean, the thing not to do is don't not call somebody. Like if you're curious about it, call somebody and just ask some questions. You don't have to do it via video. You can do it over phone if you feel like you don't want to be seen just yet. I think it's important to, at least, I say this a lot, just establish a relationship with somebody. Right, just call them up and say, hey, like I'm interested in doing this thing, and maybe I can't do this right now. Maybe I can do this in a month or whatever. And somebody might be able to hook you up. Just start the conversation.
Right. So one of the questions that I have, I talk to Rico about this all the time. There's a lot of statistic reports out there, and you know we keep talking about the mental health is a big problem for the Black community, but we have the highest statistical rate of Black social workers, psychologists, and therapists. Like that's the highest degree sought after by African American people. But yet and still we have the largest mental health issue still. And I always wanted to ask that question to people that's in the mental health field, because I was reading the statistic and it's like, that is the highest sought after degree by most African American males and women, right? Sociology, psychology, right? It's so many social workers, so many psychologists, clinicians out here, but we still suffer with the highest, mental health issues. Like, why is that? Can you help with some ideal?
One of the things that comes to mind is how people are inserting themselves into the system. I can't remember if it was you or Rico that said this. I think it was you, John. Our approach sometimes is reactive, right? And the way that we address our concerns or address our health, right? And I think a lot of the systems of care that exist for Black folks are reactive and not preventative, right? So when we see us get into the field, And depending on us, not to down what we do as professionals, it's being able to say, are we in positions, are we in roles that are actively preventing what's going on for us? Or are we just reacting to what's going on? So I use myself as an example because I'm definitely a product of that. And that when I graduated from school and I went to do my first internship, or for my first postmaster's work was actually in San Francisco, like that stuff is reactive. Like somebody's already in the system and now you're providing care for them, right? It's not stopping them from actually getting to the system. We're not doing there wasn't a program with the agency that I was working for that said, hey, you know what, on this day of the week, or on this day of the month, once a month, we're just gonna go out, we're just gonna do a presentation to X, Y, and Z community, right? We're gonna talk about mental health in that way. Like those kinds, because the funding, the funding that exists for these programs aren't preventative, they're reactive. They're saying, so once we identify that this mom has been separated from their kids for domestic violence, for abuse, this, that, and the other, we can go and talk to them so they can have a healthy relationship, potentially, right? But not saying, hey, let's go on and just kind of set up shop somewhere and talk to with moms, or talk to with dads, or talk to families in this way so we can prevent some of these things, right? Or prevent some potential solutions. Let's talk about preventative care. Let's talk about health. I don't see that those same organizations with the funding available to be able to take those kinds of actions, right? So I think that it's just something that, in talking about why there's so many folks out there, it's like, oh, there's work for if you want to go in and you want to treat what's happening, but if you want to do something that is sustainable to support the community, I don't see the same funding being made available for us.
Yeah, I was going to chime in on that because I sit in a lot of these meetings and I hear that conversation. And I think me and Rico, we always trying to figure out how do we, because we know the stigma, we know Black folks not walking in and go mental health just because of mental health they're not. So the preventative thing for us is always like, one, how do we incorporate this mental health process through the paid programs that our communities offer, right? We have all of these nonprofits in our community that's offering jobs, different things to the community. How do we make that a part of their job title? Like, right, you work 6 hours or for 7 hours and 1 hour of your day, part of your job description is to go to a therapist, right? Or if you on government assistance, like you said, the preventive stuff, like to get these assistance, to get these benefits, you have to do this therapy. Mm-hmm. Or families in schools, like that's part of it. Like, you know, like to go to certain private schools, there's certain things that you have to do as a parent, as a family for your children to even go there. How do we implement that so that mental health is a part of the childhood experience with the family? And how do we have these conversations with our parents in the community? You know, because that's the other thing that's lacking. We don't get the proper education on how to be parents, how to raise kids, and how do we get that mental health part into the raising of the kids, having a conversation. Like, you know, it's great Rico was able to step up and ask that question, how to have that conversation. But what about the moms out there that don't have that conversation? Mm-hmm. You know what I mean? That's continually affecting the community. And then already living in a community plagued with violence, drugs, police brutality every day that we see. And we're dealing with these traumas, but we're supposed to like maintain and be functioning.
Yeah. Yeah.
Like, I think that's part of the preventative talk, man. So I think that's deep.
Jada, before you ask the final question to wrap things up, I just wanted to say that, you know, to John's question and to what James was saying, I've been looking at mental health for a very, very, very long time, and I know that mental health is definitely part of the keys, and I know that there's so many keys to unlock, you know, the trauma, unlock a lot of the stuff that our communities go through as it relates to health. And I think that mental health is like all the way up there. I think it even surpasses food as we talk about like health and health issues and the cause and effect of things. I think the mind, if it's not right, that it causes all these other issues, cancer. Man, I mean, we can go on and on with all the different issues, but so I did a presentation for the San Francisco Mental Health Board, and I told them I was disappointed in them. I told them that with all the studies that they've done with African Americans and people of color, they haven't modified the work that they do based on the recommendations and the studies that they have gotten and the numbers. What are you going to do? And they had no answer. So I did a presentation for them on mobilizing mental health. like mental health should not no longer be, unless you're doing private practice and in that capacity, that's something else. But like if you're doing like departmental work, it needs to be mobilized. The language has to be changed. It can no longer be, are you going to see a therapist? Because we know the stigmas and we have to start breaking down those different barriers. So I came up with an idea that, you know, I mean, I don't know if I was the first one, but I know that I did the presentation around community wellness centers, right? And in these community wellness centers, we have an on-site wellness coordinator who is a therapist, who is a licensed therapist that have conversation with folks, who's not there to harm the community, but they look like the community and they're there to support the community. They come, they have those conversations, they have one-on-ones. It also have a certified nurse on site. And I think, John, like that's part of the way that it can be implemented into our communities if it's already there. Like, I think that the stigma is like people having to go see someone. We know about the mandatory reporting, and we know like in our community, some things is just cultural, even though it's toxic, the abnormal has become normalized, right? So some of this stuff that I can't tell you is normal in my community, so I can't have this conversation with you. So we need culturally competent individuals to come and run wellness centers in our community and pay them. I mean, like we need to pay them good money to heal the community. And I think that to what James was saying, like the way the frame of the work is created in opposition of the culture of people of color, right? So it's not, in my opinion, it's not productive. So I did the presentation and nothing came about it. I keep asking them, I'm sending letters, what you guys are gonna do? How are we gonna mobilize mental health? And then we get another report saying the African-American community is suffering from mental health issues and all these different numbers. And it's like, we just had a whole conversation about this. Mm-hmm. How do we mobilize it? Like, how do we mobilize the work, right? Because even in some of those community centers, they have therapists.
Right.
But the therapists aren't leaving the office.
Right.
Like the best case managers I've ever seen, right, are outreach workers at the same time, right? Because they know that in order to be the best case manager I possibly can be, I gotta go out there in the community and meet the person where they are, right? Yeah. The worst ones I've seen, they might have been the smartest ones, but they was the worst in terms of the actual work is because they only sat at their desk and expected the people to come to them. So I think mobilizing mental health, John, is and James, is a part of like how we can fix some of this stuff is, you know, bringing wellness in its totality to the community as a holistic approach, opposed to just saying, okay, we need therapists or we just need this. No, we need to think about the whole well-being of our community and creating a whole center, or we can do a whole initiative. And I think that we all can work on it and present it and give it to the community. Say, look, this is our initiative. We want a wellness. We don't want to just be the Band-Aid fix. We're going to touch on every little piece. No, we want the wellness model and we want to push it. So I got that recommendation that you gave me, James. I'm going to do some motivational interviewing with my son tonight. I'm going to make sure that we had that conversation. No, hey, John,
I know you serious. I know you serious. Well, we got Nicole back. She had her connection issues. I think she got it figured out. She's back. We are getting close to the end of our show. It's till 4:00, but I know Jada has one more question, and then we want to close out. We want James and Nicole to be able to share your social media, your contact information, because I see it's a lot of people out there. It's a lot of chat going on in our thing, so that people, if they want to reach out to you guys, definitely we want to make sure you guys get that information out. And Jada, make sure you ask the question about how does the community, I seen that one in there about the community organizing policy with the medical professionals. Is that one of the questions?
Yes, I'll say this last question because I do have to hop off and go to a study group. So before I ask that question, I do want to say thank you both for being here and everything you shared. This conversation was so valuable and I loved listening to everything you both had to say. So thank you. And let me just ask this question before I hop off. So the question is, can you both speak to what we can do as citizens to shift policy to support healthy healthcare access in our communities? Something like qualified providers, proper education, and healthy grocers.
Hey, thanks, Jada. Have a good day. Appreciate you.
Thank you, Jada.
Thank you.
Bye, everyone.
Bye.
To answer the question, there is a lot available for state. Of course, all that stuff is state regulated. And then it trickles down to the board of these governing healthcare providers. So I know that, James, you probably have your own governing board that you have, and then I have mine, and they have they have their own policies, and it's a big deal. But it definitely does involve the community. And a lot of those people that are involved of putting those things in place are from the community. A lot of them don't even have the degrees and educations that you and I have. They simply are a part of the area. There's the ones that make the decision on as far as education. I know that we're like an open book. Like I told myself, a couple of friends of mine, I can't spit on the sidewalk and it not become public record. So you got the whole community that can look up things, that can decide on whether we need 4 years or 2 years, or we can take this many patients and you can't take this amount of patients. And I mean, it's a lot out there that's available. Of course, fortunately now we have the internet. And so those things are available with your California Board of Healthcare and Healthcare Providers and that governing body. And you just kind of have to, even myself, I'm learning that there's a lot of boards and policies and things that as a clinician that I should be more involved in and having my voice heard as far as being on the end user side. So that's, I mean, I unfortunately don't have a list of those, but perhaps I can dig them up and then provide them to John and Rico to be able to have available to whoever watches you and listens, and they can take a look.
Right. I think one of the other things too, Rico, before we end, you know, what I'm seeing is the new doctors and some of the nurse practitioners. I don't know what's happening in the educational process when these doctors are coming to the community. It just seems that the old school doctoring for all is changing. We go into more of a prescription-based remedy before going to the, I'm just saying, even my own healthcare provider, I could call and just say I'm having an ache or a pain, like, hey, I'm gonna prescribe you this pill. If that don't work, call me back, I'll give you another one. But it's no more like the old school Mediclinic is just not happening. Like you go in there and they actually look and check. It's more of like, let's give you a drug. If that drug doesn't work and solve the problem, we'll give you another drug. And I want to know if that is the same. I don't know if that's the new teaching criteria or in the mental health. Is that the same?
It's not a teaching criteria. It's the way of the world and how things are going. They don't teach that as far as
money.
Yeah, it's the telehealth, the telemedicine genre that we're in. We're in 2020. People are seeing their doctors on a computer screen like yourself. They're making it. We're getting ready at my current employer. We're getting ready to start this tele-ED where we're, as a nurse, I'm going to be assessing my patient. And especially, I guess right now, people don't want to come to the hospital, but the days of the briefcase doctor coming and knocking on your door, I don't know. Yeah, it's not taught necessarily in that way, but I think unfortunately as technology moves, you notice that healthcare, business, all these things kind of move into that quick, but we have a voice and we have the right to say, you know, I don't feel comfortable with that. When my girlfriend got her high blood pressure medication dose increased, I'm like, why didn't you say, you didn't say anything? Right. And of course, culturally, they're used to us being okay with that. You got to speak up and say, you know what, I don't want more medicine. What I want is to maybe figure out what the underlying issue is. Maybe I'll see someone like myself, like James. James could probably get to the core of this person's pressure and figure out what tools and coping mechanisms this person needs to be able to adjust their life to get off of that stuff, because that should be the goal. The goal should not be, I'm going to up your dose every time you come in and talk about your head hurt. No.
Right.
But see, and that's another thing, people like myself, you know, especially working in San Ramon versus when I worked at Highland, I talk to my patients a little bit different. Like, dude, you know better. You need to stop. You tell me you got chest pain, but you got 2 women in the bed with you. I need you to stop. I need you to stop. I need you not to do this. You know?
Right.
I can speak to my village like that. Be like, no, you know, and even my elders, I'm like, you know what? You know, Big Mama, I need you to not do, you can't put gravy on everything.
Right.
You just can't. So I think we have to take some form of accountability, John.
That's true.
We do. We do have to speak up because the world is moving.
Yeah.
The world
I
is
agree
moving.
with what Nicole said. I think just to throw 2 cents in there is that having a relationship with a holistic provider and having a relationship with somebody who's in the system is really, really important. Like,
Right.
no, I mean, the same folks, I mean, in a similar way for lots of women who are using doulas or being able to do at-home births and whatnot, it's like they're being able to see, like, I can do this at home and have my community, my village to support me. And if I need backup, I can go and check in with the other system just because, right? But having that knowledge that is specific to us is super, super important. I think that I'm not sure who said it. I know a good colleague of mine says, let thy food be thy medicine. I think I heard Rico said a little while ago, like, let what you put into your body be your medicine before you start putting in these pills, because the pharmaceutical companies, they got billions and trillions of dollars to be able to push whatever agendas that they want to be able to push onto our community. And if we're going to allow them and allow other folks just to say, hey, this is what's available to you and not ask any questions because we haven't informed ourselves about what the alternatives are, then not to say that we can only point the fingers at ourselves, but have we done our due diligence to find out what we can do for ourselves before we start begging somebody telling us that what we should do for ourselves?
Man, that's deep. So before we go, I want both you guys to sit down with your information. Like, this topic is really hitting. I'm seeing the numbers and the people watching. So I know your information is going to be important because I see some questions they might want to reach out to you. And definitely, James, we want to reach out to you in our network. I know Rico talked about it earlier. We're doing a lot of violence prevention. And me and Rico have been thinking about some things. How do we get Black male psychologists, clinicians to work with some of our high-risk youth that's involved with some of this violence in our communities? And we know they need therapy and mental health stuff, but we also need Black men, Black women to come talk to these kids, you know what I mean? So we're gonna have to definitely keep in contact with you, see if we can put something together. But yeah, Nicole, if you could give everybody a way to reach out to you, for people to have any questions or follow up, because I know when you talked about the mentoring thing, I see some student nurse on there saying, I need a mentor. So definitely, can you just put your information out there, or how they can get a hold of you? And then James, you as well.
So where should I leave my information? Like in the chat, or is this saved? Or
yeah, we could do both. Yeah, we live. So if you could do both, you could put it in the chat, because if people are in the chat, you can put it in the chat, and then if you could just say it to people how to follow you, or you know, you can just say it verbally, and then people will be able to pick it up. We will replay this, so people that missed it because of football games going on, they'll be able to see it later, and they'll be able to get out there.
Raiders are playing. I don't know what they're doing though.
They're not doing that great.
Okay.
But again, you know, while you guys doing that information, I just want to say thank you again. This was a very powerful, helpful, informative conversation. I mean, I even took a lot of things out of it for myself, and definitely James is talking about the structure of your day-to-day livelihood, just being more thoughtful of what's going on with you in your body, your mind, and your day-to-day actions. Very powerful. And definitely we ask you guys to definitely reach out if you have anybody in your network. Next week, we're going to continue this part 2. It's going to be more focused on mental health. But Nicole, you're welcome to come back. Any of our medical professional doctors that's out there, we're going to have another segment next week of this. So if you guys would like to be involved in the panel, please reach out to us at both sides of the conversation at Gmail. We'll reach out to you, get you all signed up so you can get on and have this conversation as we're going to continue about mental health and some of the health issues for our part 2. We had a couple people that was unfortunately unable to make it today, and hopefully this next week we'll be able to get some of them back, and I think it'll be even more amazing conversation.
It's been a pleasure to hang out with you guys today. It's probably one of the best panels I've done all year. Great personalities here: Nicole, Rico, John, and Jada. It's been a pleasure. Yeah, I'd be happy to connect with you all in the future for any collaboration. Just kind of sit down and chat, just like whatever y'all need, I'm happy to engage. Right? I think that if just to say it out loud, for folks who want to get a hold of me, reach out to courageoushealingcollective.com is my website. And then on IG, it's the same. I just think I put Courageous Healing Collective, INC, incorporated on the end of that. I'm putting together some, or it's already done, it's kind of waiting for it to be published, some flashcards for folks to be able to identify some basic emotional confidence and apply that to some languages spoken in Africa and also in the diaspora, just so that we're able to do that with some prompts to be able to support folks and having conversations like we're having right now about connecting to how they're feeling and sharing that with folks, especially in their family settings.
Likewise, thank you guys for having me. I really enjoyed myself. I would do this anytime you guys invite me. And I'm going to be spreading, I have a couple colleagues that I think would be amazing to contribute some of their knowledge and experience also.
Cool. Thank you guys. And yeah, we have all these powerful conversations. We definitely keep you guys in our data bank. We had, I wish Nicole would have been here, Rico, for that when we was talking about some of the things that the church has affected from a medical perspective, because I think that would have been huge to have her on to talk about.
Yeah,
that.
I would love to. At my church, I tell them.
No, hey, John, you look. We coming up where we finna start going back into different segments, relationships. Oh man, I mean, so we didn't hit a lot of
Definitely, we got to get Nicole on the right relationship thing, because she got a thing that she does, and I told her that we got to get her on for the relationship thing. So yes,
yeah. And it'll be good to have you both on, because like we definitely need both perspectives, especially coming from.
Yeah, you're gonna need the mental health counselor for the
you
relationship.
Definitely need that, because like, oh my goodness, black relationship. Woo. That was one of the topics right there. Yeah.
Yes.
Yeah.
So
James,
we have to put something together.
What is that
We're
on
gonna have to
your
put
shirt?
On my shirt, so I tell folks that I come from a family of healers. There's some folks that have been involved in like medicine or involved in supporting folks in one way or another, and I have a set of aunts and uncles who live in Arizona that have it's a group home for boys and also a group home for folks who are developmentally delayed, and it's actually called It Takes a Village. So they're doing that thing out there. I still do consult with them and provide some services for them down there. So that's what It Takes a Village is on my shirt here.
Okay. I was very intrigued with that. Like, oh, okay, takes a village. Okay, brother deep right there.
Right. Well, definitely we'll be reaching out to you guys in the future, because we are going to be having those relationships, those tough conversations about dating today in 2020 and